Maatsi'say'piiyaakii. My English name is Renate Good Striker. I'm the long-term care nurse manager.
So, what is tell us a bit about the continuing care program.
Um, Currently, we have 22 residents that are on site, and we are almost to full capacity. And um, the residents are holding up. It's a little bit difficult at this time for them as they're lonesome for family members, but they are also aware of the pandemic and the seriousness of it. So they do ask questions. In the beginning, they were very lonesome, but at this time, I'm feeling, and speaking with the residents, I'm feeling that they know that they're safe and they are lonesome for family and friends, but they do know what the precautions are. And we are partners with Alberta Health Services. So the mandate is that they have 2 essential visitors, but as of September 3rd, we close the doors for the public just to secure the residents and the staff for COVID and, of course, the variant. Um, that's how they're doing. Yeah.
Okay. So, what activities, I guess, do you have for them? Is there any enhanced activities or anything to kind of keep their mind off being lonely and isolated?
Currently, we do. Recreation therapy would speak to that, but when I'm on the floor, I see that she's involving a lot of the residents and trying to get them involved in bingos, whatever activities they're having for the day. And from the manager, from my perspective, I'm having the staff, even if they need to have a break, they can sit down and just talk with the residents, and especially for the ones that speak Blackfoot, to continue to speak Blackfoot to them. It seems like they're able to communicate and get their feelings out better that way through Blackfoot. So it is busy back there, and the staff are coping, but just as in all other sites throughout Alberta Health, would that for the people that our partners are with Alberta Health Services, there is a shortage of staff throughout those places.
So, what protocols have been implemented since this fourth wave has created a surge and put a strain on the Alberta healthcare system? And now we see 137 cases here on the blood reserve. What guidelines have been put in place and restrictions?
Okay, so just as I said, as of September 3rd, we secured the doors, and so therefore public and family are not to see their family members, but we certainly invite them to come to the window and speak with them whenever they have time. And I know everyone has been trying to be safe and being home, but yeah, that's what we're doing, and keeping them, I guess, occupied that way with recreational therapy and family coming to the window and visiting with them, and also staff.
So, how has the families and the friends how have they been holding up?
At first, I'm going to say that they were a little bit upset that they couldn't see their family members, which is very understandable. And but as the pandemic went on, the families were more understanding, and I guess in keeping their family members safe, their moms, dads, grandmas, grandpas, and so that's how it's coming along. It's really difficult because just like going through everything that's happening now with the residential schools, and they like to keep up with the news, they like to read the papers. Through everything that's happened, it's opened a lot of old wounds in regards to residential school. So not only are we dealing with the pandemic, but for our residents, we're dealing with old wounds coming up from residential school. and having to talk with them and just hear their stories. It is very saddening to, just watching it on TV, but to know that we actually have people that have gone through it. And we do have help from wellness coming in to do visits with the residents, but they are also aware that it's limited for staff coming in. We do have like tablets and that they're able to FaceTime or be in touch with their families. They have telephones in their own rooms, so that's another way that they're keeping in touch with their families.
How important is it for them to be home, to have a place here on the Blood Reserve to be in continuing care as opposed to being in Cardston or Lethbridge? How important is it to have this continuing care here?
Well, I think it's huge because I think, and I like to stay positive about everything and keep an open mind, but they are more comfortable with someone of our own kind. I do know that we have had a couple of residents that have come from off the reserve that were in facilities, and they did mention that they didn't feel at home. They felt like they weren't being treated fair, if I must say. It feels a little bit harsh, but I'm just giving information that was given to me from the residents. But so yeah, it's very important, especially to have people to speak the language, and a lot of them are older back there, so having someone speak your own language is huge, and communicating how you feel, what you want to talk about, and they're able to vocalize more that way. So it is very important, and I'm very proud to be the nurse manager at this time. It is very difficult, but at the same time, Blood Tribe Department of Health, we are a partner with Alberta Health Services, so we do follow the continuing care standards, and so that keeps us quite busy with keeping updated regarding residents, the building, IPC, that's infection control, and preventative in preventing infection. So we're always busy back there, and it's a busy place, and it's also a very stressful time.
So going into this long weekend, Thanksgiving, any special activities planned, or?
I'm gonna say that I don't know, and I don't want to say I don't know, but my office is across the building, and I do know that recreation therapy, they do have people coming in on weekends when they can have the staff, and just as I said, there's a staff shortage everywhere, and it's affected everything from the kitchen to recreation therapy, nursing staff. And the thing is, for long-term care, staff are only allowed to work at one site, which is called single site working. And so if we were really short of staff, then we would have to apply for a single site exemption, where we would get an employee from another facility. So it is a hard time right now regarding staffing, and I can promise that the staff are doing their best to keep the elders happy and safe.
Any last comments on how everything's going there?
Well, I'm thankful that we've only had one outbreak since this whole pandemic. It was a very stressful time, not only for the staff, but especially for the residents. And I would like to invite the families to come and say hi to the residents at their windows if they can, whenever they can. And even to come by and, wave at the residents or to talk to them. I think any face right now makes them happy. The ones that do sit at their windows that can face the road, it keeps them quite happy just seeing people walk by. So just people coming by to say hi, that would be awesome.
Mm.
Hmm.
Thank you very much.
Thank you.